If you spent more than 3 nanoseconds on my site, you'll know I'm a fan of cutting off hypergranulation tissue concurrent with an ingrown toenail. I think it shrinks back faster. I think with the chronic ones that are really fibrosed, they never fully shrink back. So another video to show you how relatively straightforward it is, even in a very nervous patient. Negative.
Yeah.
Do you know the best thing to take for a cough?
Honey and lemon.
No.
What?
Laxative.
Because you're too scared to cough.
Exactly.
Yeah.
There we go.
Yeah.
It's bad, isn't it, when patients are doing my own punchlines for me. So, I'm just going to give that toe a clean. So, you join us 10 minutes in. We've done consent. We've done digital block at the base of the toe. I've actually used Narrapin. How you feeling? Okay.
Yeah, that's just really weird because I can see you touched it, but I can't feel it.
You can't not feel no pain.
No, that's just really weird.
It is odd, isn't it? Now, can you see the you keep an eye on the camera, making sure your toe's still in shot for me?
Yeah.
So, all right. So we've already done a skin prep. We're just really redoing now, but it's nice and nut. So I'm just going to check. There's no sharpness. So sharp or blunt?
Can't feel it.
No, nothing there.
No.
Awesome. Okay. I think, because I'm getting old, I'm going to sit down for this one, Kai.
Okay.
So first thing we do is a little tourniquet.
Yeah.
So there's no bleeding. So this is the most difficult bit of the procedure, getting these little loops on. It is normally a good check as well that the toe's nice and numb, because if we'd have done that to you 10 minutes ago,
I would have been screaming.
you'd have been a little bit oozing out. Yeah. So
Yeah.
it's always a good little test. But it's super helpful that there's no bleeding while we do. They do have these little buttons you can use, but I actually find them more trouble than they're worth. Get out of the way. Okay, so we're good. We're still in shot there, Kai?
Yeah.
Cool. So what we normally do is just have a little test, see how it looks down the side. And that's really sore. And you've got all this hypergranulation tissue on. So first thing we're going to do, you okay with talking to the camera?
What, you?
Yeah.
Yeah, you carry on. I'm just not going to be able to look at it.
No, ignore me.
I mean, please look at it.
I'm looking. Okay, and then I do normally 2 cuts. We're still in shot there, Kai?
Yeah.
Don't lose all the good stuff.
I'm keeping an eye out on my eyes.
It's funny because if you watch the phone, it's not like you're watching you.
No, it's like I'm watching something.
And then you grab and then you do, I call this a little alligator roll. Get all the nail. So you actually, there's a bit of a shoulder of nail down the side, and that's really what's caused the issue. You've done a little bit of self-care.
Yeah.
And then we're just going to tickle away. Now, you know I said I actually take away some of that hypergranulation tissue. So this is what makes it heal quicker. So just to get this out of the way, it's really just a sweep with the blade. So they will bleed a little bit more afterwards.
Yeah.
And then that's gone. I'm just going to tidy that up a little bit more. But they heal so much quicker. I've got a few cases that have come through and they've been done by really good local podiatrists, but they've tended not to. I'll move the phone. My bloody baked feet. Sorry, thank you. And they've done really good nail surgery, but haven't taken away that hyperground. And it kind of eventually settles, but it can take a lot longer. It just heals so much quicker if you do that. So that's basically going to just heal in like this, and then that's it. Now 3 minutes of phenol, and then we're done. So I normally like to get the first dressing change done quite quickly because you'll get a little bit of bleeding afterwards.
Yeah.
Takes about 4 to 6 weeks to heal, nearer 4.
Okay.
Because of the acid, you get a bit of an acid burn. But if we just cut the nail and let it grow back, you'd be back again within a month.
Yeah.
Within a year, excuse me. So they did some studies, 40 years ago, years and years ago. They did about half a dozen studies over about a 10-year period, different doctors, where they just took the nail off and let it grow back, did nothing else. 70 to 80% recurrence rate. We've known this for decades, so you really do need to do something to that root.
Yeah.
Otherwise, we'll be having this conversation again in a year's time. It's a very high recurrence rate, I think, 70 to 80%. But we'll see, some GPs will do that. They'll just take the nail off,
Yeah.
and then it will grow back, and then guess what? The patient comes back in a year with an ingrown toenail again. maybe the nail shape is a bit awkward, or maybe their nail care that they do isn't great.
I'll try and look after my nails.
Yeah, so we don't want to make the toenail too narrow, just so it heals in. And it looks like I've taken a real sweep of tissue out. It looks like there's a great big hole.
Yeah.
It's amazing how that fills in really quickly. But the overall healing is much quicker, having taken off that hypergram.
Yeah.
So I'm just going to get a dressing prepped. Questions, what can I tell you?
I assume, like, obviously I can't get it wet because we're dressing.
Yeah, until we change that first dressing, just keep it dry for the first few days.
When does the first dressing need to be
That,
by?
well, ideally tomorrow or Monday. It's Friday today, so nice and
My
soon.
best friend who's a nurse is coming over tomorrow.
Oh,
She
I'm loving
will
that. Yeah, absolutely.
Perfect. She will also be loving that.
Yeah, she'll love that. Saltwater foot bath when you change the dressing, that's really good, I think, just to kind of give it a nice soak.
That's what I've been trying to do with it anyway, just to keep it clean.
But
because
because of there's a little bit of contamination there.
Yeah.
There was a little bit of an odour there, but it wasn't infected. It's what I would call clinically contaminated. But that's where it was kind of growing in there. You could see that shoulder of nail. Any other questions? Now's the time to ask.
So yes, it could take that long to heal, but it's going to be just normal. Just make sure the plaster's covered.
Yeah,
it
yeah.
doesn't get wet. And
Well, keep it dry while you got the plaster on. But when you're changing the plaster, I really like a saltwater foot bath.
Yeah.
So warm salty water, have a soak for 4 or 5 minutes. I think it's really good to let it kind of draw out, and that shoes to tolerance is fine. So then we're going to put a bit of a dressing on. So I tend to use a bit of this non-stick. I like a bit of iodine, just to keep everything covered. And then the second most difficult thing is getting this thing off. What I like to do is get a bit of compression on, because that thing will bleed like bilio. So I like to get a bit of compression on straight away. You check at the end of the toe to make sure all the blood's come back, and it's come back instantly. But if I don't get a bit of pressure on straight away, I end up with a little bit of claret on the floor, as they say in a Guy Ritchie movie. And then a BFO bandage, because they will bleed a little bit. And then what we're going to do, we're going to keep you in the chair for about 5 minutes, Kai, just to check that we don't get any strike through bleeding. You can get a little bit, which is fine, because everybody stops bleeding eventually. That's a known fact. We know this. And I'm just going to hold that there and see how you do.
Okay.
You were fabulous. Thanks for the video.
Go on.
I'm going to stop that there. And she went on to do really well and heal quite quickly. Different case, it's a bilateral case. You'll see there's a little bit of trauma to the nail plate, and that will settle down. And you'll sometimes see that with a bilateral case. The thwaites can be a little bit unforgiving. This is a case that had a lot of hypergranulation tissue pre-procedure, and this is 2 to 3 weeks post and almost completely healed. If you've got a little bit of an interest, then there's an article that my colleague and I did a couple of years ago, Nicola Burt and myself, on peri-ungual soft tissue resection, and you should be able to find that from my ResearchGate feed. If you've got an interest, we talk about it at length. We are quite the fan. As always, thanks for watching, guys.